Hello everyone, this is Justin from LitTube, and this is another Face2Face video. This week I want to talk to you about a debate that happened on CNN regarding the future of healthcare in America. It was between Senator Bernie Sanders from Vermont and Senator Ted Cruz from Texas. Now, in this debate, it was a really interesting exchange because really what it boiled down to was two polar opposite fundamental philosophies. You have the free market approach to healthcare going up against the single-payer Medicare for all system for healthcare. So they're polar opposites in the sense that one is essentially completely government-controlled, that is the single-payer system. The other one is completely dependent on capitalism and the free market, which was more what Ted Cruz's proposed plan was, using the free market to dictate healthcare and the results in terms of price and how you get it and all those things. So I want to just break down first where the senators agreed. They both agreed on one point, which was that if we allow the United States to import prescription drugs from other countries, such as Canada or wherever else in the world, Canada would be the most obvious since we're bordered with them, but they agreed that the United States should allow drugs from foreign countries to be imported at a lower cost. The idea behind that is that, the pharmaceutical industry, prescription drugs in the United States are just too expensive, prices get jacked up, and if you allow importation of those drugs from other countries, that's a way to get the same drugs at a significantly lower price. The two senators agreed on that. I personally think it's a great idea, and if they can make a compromise and get that done in Congress, that would be wonderful. So that's the one area where they definitely wrote an agreement. Pretty much everything else, they seem to disagree. I want to start with Ted Cruz's plan. So Ted Cruz's plan that he's proposing here is very similar to what Donald Trump talked about on the campaign trail, in the sense that you were talking about removing the lines between the states, making it so there's competition between insurance companies all over the United States. So as it stands now, if you live in Maryland, you have to get an insurance plan from a company that's in Maryland, and the Maryland companies compete. What Ted Cruz is proposing, and what Donald Trump talked about on the campaign trail, is removing the lines between the states, making it so that insurance companies all across the United States compete with each other on price. So that is essentially the free market plan, to increase competition, and the increased competition, in theory, would then decrease the prices that you pay. Now, there's other variables that, of course, go into that because, perhaps the lowest price plan in the market also has the highest deductible. I mean, that's probably how it would work out, that the lower price plans would have some other downfalls to them, of course. But, in theory, given the way things stand now, I can see how that could be helpful because, in theory, if you have less competition among the insurance companies, then, a bigger chance of essentially a monopoly happening, and the companies can charge whatever they want. So the last component to Ted Cruz's proposed plan that really stuck out was that he wanted to reduce the regulations that the FDA currently has, and he cited a couple examples, the most notable being actually from a movie, The Dallas Buyers Club, where Matthew McConaughey's character is someone that gets diagnosed with AIDS, and he basically can't get prescription drugs that are effective within the United States, so then he has to go all over, to Mexico and try to find alternative treatments that the FDA doesn't approve in the United States. Never mind the fact that that movie, the setting for that movie was like the 80s, so it's not too relevant, actually, but I think he gave a couple real-life examples as well. I mean, people that are battling a life-threatening condition, there's certain drugs that are approved, but maybe they don't help. Maybe they want to go to an experimental treatment, and the FDA denies them. So I actually kind of agree with that too, except for in the sense that if you reduce the regulations too much, obviously you can have big problems. You can have drugs, that get passed through and are approved that have terrible side effects that could possibly even kill people. When you're talking about laxing regulations, you have to be careful. Okay, I understand his point. That, for example, he referenced that there's like three cancer drugs that got approved over the past decade or so, and that in theory there should be more that get approved. There, if a different country, especially a first world nation like Canada, somewhere in Europe, approves a drug, then it should probably be approved here. I mean, that's essentially what he was getting at, is that if it's approved in another major country, it should probably be accessible here as well. And I understand his point on that, but my one rebuttal is you have to be careful just how much you're decreasing the regulations, because if you completely do away with the majority of regulations, honestly, the pendulum swings in the other direction, and you get to the point where people are just getting prescribed drugs that are unsafe and not tested enough. So you have to be careful with that point. So Bernie Sanders, when Ted Cruz asked him, like, hey, do you agree with that? And Bernie was like, I'm open to the discussion, basically. He was open to the suggestion, but he was not wholeheartedly committed to that approach, as they both were in wholehearted agreement on importing drugs from other countries. So that's the essence of Ted Cruz's plan. And Ted Cruz defended his plan mostly by bashing Obamacare. And there are bad parts to Obamacare. I think even, liberals have to agree that the results of Obamacare have not been fantastic. There have been good things from it, from my perspective. I mean, the fact that, insurance companies can no longer deny you for having a pre-existing condition, I think that's an amazing part of Obamacare. I also think that, the fact that people can kids can stay on their parents' insurance policy till 26. I do see that as a positive, especially given the current climate. Millennials are not making enough money to really be affording that kind of insurance payments. So those aspects of Obamacare, in my view, are good. But where Ted Cruz bashes Obamacare, and rightly so, is the fact that basically, if you're very poor, the government's going to subsidize it to the point where you don't have to pay much, and that's great. If you're elderly, it also helps. But the younger people get hit hard with huge insurance payments, and at the same time they'll have a high deductible. So, for example, my older brother, so I know this firsthand, my older brother was looking around for an insurance plan with Obamacare, and they were trying to get him to pay like $400, $500 a month. And remember, this is pretty much a healthy young person. $400, $500 a month to get insurance. And then the deductible was like so high that like he would basically have to exceed 10 grand in a year worth of healthcare payments before they actually started covering things, before they actually started paying for his treatments and whatnot. So you can clearly see that that's a huge ripoff. And what my brother ended up doing is instead just taking the penalty from Obamacare. Like, basically they say, okay, if you don't have health insurance, whether it's through employer or on the Affordable Care Act exchange, then we're going to fine you. So my older brother took the fine, because even though you're basically taking a fine to get nothing, he viewed it as the insurance was the bigger scam, the bigger ripoff, based on how much he had to pay. And a lot of people do that. A lot of people have been taking the fines because they just can't afford the insurance. So Ted Cruz does make a fair point on that. That was a bad thing about Obamacare. But I think where Ted Cruz's argument falls a little short is that the real discussion, the real meat and potatoes of this debate between Bernie Sanders and Ted Cruz was not really defending or opposing Obamacare, because even Bernie admitted there were problems with Obamacare. The real debate was about Ted Cruz's proposed plan versus Bernie's proposed plan. And Bernie's proposed plan was not Obamacare. Bernie's proposed plan was a single-payer healthcare system, basically taking Medicare, Medicaid, and just expanding that so that it fits everybody. Everyone in the country is covered. And Ted Cruz's one major objection to that, because he honestly, guys, Ted Cruz was struggling to put together really solid arguments against that plan. Mostly his arguments were more about like why Obamacare was bad and why what he was trying to do is better. But the one point he made that I actually did think was a pretty good point against the single payer system is that he said, okay, you look at the United Kingdom, you look at Canada, you look at all these other countries that have done the single payer system. And what's the problem with it? That you have to wait an extremely long time in many circumstances to get care. And he said it ends up making it so the government's discriminate against elderly because they view them as, less important than making sure that, young and middle-aged people get their health issues taken care of. So those are the kind of points he was making, is that like, hey, like in some cases it causes discrimination against you for being old. It causes long wait lines to get treatment. And there is some data to back that up. I mean, so that is a fair point. But with all that said, no system is perfect. You're not going to find a perfect system for healthcare. There's going to be always some level of flaws that have to be, addressed, or there may not be a way to get around. But that was his major argument. That and the whole, you have a right to healthcare access as opposed to a right to healthcare. That was another fundamental debate question. It was basically coming down to is like, hey, Ted Cruz believes, you have the right to life in pursuit of happiness and all that, like in the Bill of Rights and the Constitution, but you don't have the right. I've heard this argument before on with conservatives. You don't have the right to healthcare because if you literally had a right to healthcare, what that would mean is that if all the doctors and nurses quit their jobs, like, you'd have to hold a gun to their head and say, hey, I have a right to treatment. Like but that's kind of like a far-fetched, stupid argument, because you're never going to have a situation where all of a sudden magically all the doctors and nurses up and decide to quit their jobs. Like it's not something that would realistically happen. But with all that said, Bernie's plan, yes, you do look at that potential weakness of, okay, there's going to be long wait lines. And it makes sense because, if everyone's covered and everyone goes to the doctor when they have a problem, then yes, there's going to be longer wait lines because more people are seeking treatment. But the thing is, with Ted Cruz's plan, leaving it all to the free market and leaving it all to capitalistic ideas, I mean, honestly, I identify with the conservative arguments on those types of things in a fair number of circumstances. But the reason I believe healthcare is different is because healthcare, you're talking about people's lives. You're talking about life or death situations. And that's not something you can really leave up to chance or playing around with. So that's why I believe it is important to have a system where everyone is guaranteed coverage. And that's what Bernie Sanders' plan does. He's advocating the single-payer healthcare system. It basically all comes down to, it comes out of your taxes. I mean, it's not free, and people are going to be taxed for it. Bernie's argument is if you're poor or middle class, it's essentially, even though you'll be paying a little more in taxes, it's going to make up for it in the healthcare savings that you're getting. Comparing it to what you would be paying if you had a private insurance company. And that's the interesting thing also about Bernie's plan is that you're talking about eliminating essentially the private health insurance companies that everyone knows they exist to make a profit. All corporations exist to make a profit. They don't exist to solely provide you products and services, and in the case of healthcare, to get you better. No, it's about making money. That's what it's about. And Bernie's point of view is, hey, the moral side of this is, making money should not be more important than making sure that all the United States citizens get health care. And so they had an interesting back and forth in this, and there were situations where, CNN would have people ask them questions, very specific questions. One of them was, from a hair salon owner that was trying to expand her business. She was saying, hey, I can't afford to pay for health insurance for my employees, and because of Obamacare, I can't expand my business because of the increased costs. I'm staying under 50 employees, so I don't have to like be obligated to buy them insurance, blah, 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 blah. And in my opinion, Bernie actually initially had a bad response to this because he essentially said, oh, yeah, you're a business owner? Oh, well, like, you should probably be providing health insurance to all your employees. Like, that would make you more, like, in order to compete with the market. But he was kind of missing the point that, in that type of industry, like hair salons, small business owner, like, my father has a small business, and I can tell you right now, if he can't afford to give people health insurance plans. He can't afford to do that for his employees. Small business owners, a lot of them would get knocked out of the marketplace immediately if they had to do that. So that's a little fundamental key where Bernie he kind of didn't understand like the burden of being a small business owner. Because like that's the thing. There's a difference between being a small business owner and being a CEO at a huge corporation. Huge corporations have money to blow. They have plenty of profits. They have huge revenues that they can actually afford to provide health insurance plans to their employees in most cases, unless they're like a big failing company. But all those big profitable companies, I mean, they're making money hand over fist. The burden is a lot higher on a small business owner. A lot of times, you may be struggling to pay even minimum wage to your employees in certain cases. Now, in those cases, maybe you shouldn't be in the marketplace. Maybe you should go out of business. But you get what I'm trying to say. The burden is higher on the small business owner that is struggling to make a profit compared to the big corporations that are simply trying to grow their already huge profits. So Bernie kind of missed that. That's when Ted Cruz swept in and, started saying, yeah, I understand, like, you're trying to run a business, you need to be profitable, you can't be, affording to spend all that money. Then the interesting thing is that same woman admitted a little bit later, like, yeah, there's a period of time where I didn't have health insurance. And my employees didn't either, but I even didn't. And that's, I think, when Bernie realized, oh, this isn't some rich business owner. Like, this lady actually is struggling to have her business. And that's when Bernie was like, hey, listen, like, I understand what you're saying. And the solution to that is to give everyone guaranteed healthcare coverage with a single payer system. And there were other questions that were brought up that were kind of similar in nature, but not from business owners, more from like average normal people, where they would say, hey, like, I was diagnosed with breast cancer, or like my daughter had this really rare condition and needed this certain type of prescription drug. And it basically all came down to, like, they were all saying, yeah, like, Obamacare actually saved me in this situation. Medicare saved me in this situation. If I didn't have that, like, I'd be completely screwed. I wouldn't be able to take care of myself or my daughter or whomever. And in my opinion, Ted Cruz struggled to answer those kind of questions. He kind of deflected. He went back to, just talking about why Obamacare is rising prices and everything. But I don't think Ted Cruz effectively answered those questions and why and how the Republicans could save these types of things from happening. I mean, like, they basically straight out blank asked him, like, hey, like, say what you will about Obamacare, but it did stop people from pre-existing conditions from getting discriminated against by the insurance companies. And is that something that would go away with a Republican plan to replace Obamacare? And he could not commit to saying, yeah, people with pre-existing conditions are going to be covered. He did not say that, could not say it, because that's not part of what the Republicans seem to be proposing. Interestingly enough, Donald Trump, after meeting with Obama for the first time, kind of saw the light a little bit and was like, yeah, like, I would like to keep some of those positive things that were in the Affordable Care Act and carry that over to my replacement plan. But honestly, folks, at the end of the day, I don't see the Republican administration really going for that. And I think Ted Cruz knows it. I think Ted Cruz knows that, like, yeah, there's not going to be any real protection against pre-existing conditions or anything like that. So, I mean, say what you will. I mean, like, even if you are totally against socialism, like you think socialism is ineffective, expanding government is terrible, even if you believe those things, you have to answer this fundamental question, should everyone in the United States be able to have affordable health care? The only real way you can assure that is by going single payer, because if you don't, there's always going to be someone that can't afford to pay their health insurance. There's always going to be someone that's getting taken advantage of by a private health insurance company. Those issues are not going to go away no matter what unless you have single payer. So at the end of the day, I tried not to let bias come out on this, but honestly, I do believe Bernie Sanders' plan is better than Ted Cruz's plan. Ted Cruz's plan, I don't doubt that it would decrease costs compared to Obamacare, but the problem is you're still going to have a ton of people that either don't have insurance because they can't afford it, or an insurance company denies them because they have a pre-existing condition. And that is just something we cannot be dealing with in this modern age. Like, it's time to step up to the plate and be able to put that issue to bed. And Ted Cruz's plan simply can't do that. Bernie's can. And I understand all the points about, hey, like the problem with Bernie's plan, like waiting lists to get treatment, having to raise taxes a ridiculous amount. I get that, but honestly, guys, the alternative of like actually having people like having to die because they can't get treatment, like that's awful, And the United States, being as rich as it is as a country, should not have to deal with that problem. There should be safeguards in place to deal with that problem. And Bernie's proposed plan deals with those issues much better than any Republican proposed plan up to this point. Now, the funny thing about it is, like, if Ted Cruz just would have said, look, I want to make it free market, but I want to like make it so the insurance companies have to cover people with pre-existing conditions and are not allowed to jack up their rates. Like, if there's a way of doing that, like, that would be a step in the right direction, honestly. But like, I don't think there's a feasible way to do that, nor do I think the Republicans really want to do that. So that's kind of where this debate ended up. It's the classic free market with no safeguards in place versus a government-controlled healthcare. Honestly, there's flaws in both, but if you look at the benefits, of each plan, I side with the one that gives everyone health coverage, and that's the way I see it. Like, because this isn't, car insurance is optional, insuring your home is optional, insuring your jewelry is optional, but when it comes to insuring your health, that's life and death, and I don't think anyone should be in a situation where they cannot pay to make sure they stay alive or that their kids stay alive. And that is the part where I believe that Ted Cruz and the GOP are out of touch, because they don't understand there are plenty of people in this country that no matter, even if the free market like drives down the costs and we assume that insurance companies don't try to scam people, which by the way is a dumb assumption, but let's assume for a second that private insurance companies don't really try to scam people like that. Even still, there's going to be people that die because they can't afford to have health insurance, and or maybe it's even out of ignorance. Maybe they just figured health insurance, I don't need it. I don't need to be paying that extra money for that, and then they end up getting a condition, and it's a they have to die, So by just making it so everyone gets covered, it's the simplest solution, folks. It honestly is. It's the simplest solution. It's going to save lives, and as far as the cost, hey, I'm sure we can find a way to, either make it so the rich take more of that tax burden, or make it so that we cut back expenses in other areas of our government. And there are areas to cut back on, but that can be saved for another video. I know I've gone on for a long time, but it was an interesting debate on CNN. If you haven't watched it, if you didn't watch it live, I'm sure there might be a way either on CNN's website or somewhere on YouTube. They're probably going to upload it, and make sure you go and watch it if you have that opportunity, because it's long, but it's a really good debate. And it's going to make you rethink, what comes after the Affordable Care Act.